Welcome, everyone, to another edition of SCRC's Let's Talk Caregiving. I'm your host, Roberto Velasquez, President and CEO of Southern Caregiver Resource Center. And I'm here, as always, with my co-host, Marta Rañón, our Executive Vice President. How are you doing, Marta?
I'm doing great, Roberto. Happy to be here.
Fantastic. Today's special guest is Dr. Michelle Jackson. Dr. Jackson is a nurse scientist, nurse practitioner, and associate professor at Point Loma Nazarene University, where she also serves as the nurse practitioner program director at the university. Dr. Jackson has nearly 15 years of clinical experience caring for older adults with complex physical, functional, and cognitive conditions. Her research focuses on health equality, mental health in minority groups, and Alzheimer's disease and related dementias, with a particular emphasis on Black African American women. Thank you so much for joining us, Dr. Jackson, and welcome.
Thank you for having me.
Dr. Jackson, I am so glad that you are here joining us because, as you know, we do a lot of work with family caregivers, and oftentimes the caregivers are caring for individuals who have dementia. So I was very interested to hear about your study that you are conducting, and maybe you can share with us the details of this specific group that you are hoping to learn more from.
Absolutely. So, this research study is being conducted from out of UCSD, University of California, San Diego, in collaboration with University of California, Los Angeles. And so, we are specifically looking at older Black African American women who are at risk for Alzheimer's and related dementias. And one thing in particular about that demographic is that many people may or may not know, but African American women have the highest risk for developing Alzheimer's and dementia, however, are the least studied. And so that is where the um, research is coming out of because we want to know why.
That sounds really interesting because I know that a lot of our clients, again, who are taking care of someone with dementia, there are a lot of studies. We're so fortunate to live near UCSD because there are a lot of studies that are being conducted, but oftentimes our caregivers are not aware of these studies. And so, my question to you is how does one apply, or how do you connect with the study to participate in?
That's a really good point that you bring up. And you are right. There are so many research studies that happen, but they're either at the university or they're way far out and it's difficult for people to get to. One of the
Mhm.
beautiful things about the BWITS, the Black Women Inflammation and Tau study, and we call it BWITS for short, one of the unique aspects of our study is the fact that it is a community based participatory research study. So we actually are in the community. So we have partnerships at different locations. We are currently at the George D. McKinney Retirement Center. That's one of our locations where we conduct study visits. But we are actually out in the community. We are educating on brain health and equity. And then we also talk about our study during that time. And if anyone is interested, we usually have a sign up sheet. We have plenty of brochures and pamphlets and cards. And believe it or not, Martha, we also get a lot of word of mouth because
Mhm.
when we have women who have taken part of the study and they're like, oh my goodness, I'm going to let my, sister know, or I'm going to let my friend know. So what we do is really a part of the community.
Dr. Jackson, thank you for sharing that because I know from my experience working with minority populations, I've worked primarily with the Latino community here in San Diego County, but I've also worked with the African American community. And one of the very important things for both Latino and African American communities is to bring the services to the community. If you don't, and you expect people to come to you, it's not going to happen. So you always have to be culturally sensitive of the communities that you're trying to do outreach to include them in programs that are designed to help, designed for that particular community. And I think one of the important things that I love about these studies now, especially your study working with the Black women and Alzheimer's, is that you are doing, going into the community, doing the kind of work out there and doing the, like you said, word of mouth, presentations, even presentations unrelated to the actual study, like brain health, or even subjects like the worried well or something like that, to get the interest and get people in there, and then explain, hey, by the way, we have these studies going on, here's how you could benefit from them, and so forth and so on.
Dr. Jackson, was thinking about this because I know working with caregivers in the community, there is hesitation, especially in very specific minority populations, to participate in these type of studies, right? There is a stigma when it comes to dementia. It's very much a thing still. There's also culturally a hesitation because you don't really talk to others, especially strangers, about the health concerns that you might have at home. So what are some of the challenges that you are finding with through this study, and how do you address them?
Martha, let me just add to that before Dr. Jackson answers, because I know from a historical standpoint, there's also been a lot of problems trying to engage minority populations back from the Tuskegee experiments in the Black community, and in the Latino community with ICE and immigration policies and so forth. People are nervous about disclosing information or going somewhere. There's a distrust that happens. But yeah, I'd love to hear, Dr. Jackson's point of view on this.
Roberto and Martha, you guys both bring up some really um, unfortunate truths when it
Mhm.
comes to the historical involvement in participating in research when it comes to diversified and minoritized groups. It doesn't hurt that I am a native San Diegan from the community in which I serve. So I think
Mhm.
that goes a long way. Um, for me, just being a part of this community from the time I was born up until now, I know and understand and see the community in a way that many researchers that are at universities who
Mhm.
don't live in the community, they don't see or appreciate the community. So that certainly helps me to be part of the community in which I serve. But the other thing, too, that I've learned, even through the unfortunate historical things like Tuskegee, and we think about Henrietta Lacks. When I think about that, the way that our project and the way that our study, we don't dismiss that, and we do not ignore that that has been a part of the thread of our country. So when we are recruiting and when we're talking about what we do, because we do take a blood specimen. And so, the antenna goes off like, okay, well, what's going to happen with this blood? What are you doing with it? Who's going to end up getting it? And so we were very much intentional in conjunction with our community advisory board about making sure that the community and making sure that those who are wanting to participate in the study know what's going to happen with their specimen, know what we're doing with it. So we want to be transparent.
That's great. And of course, that's very much appreciated. I wanted to ask you, what is the process of this study? How, let's say you have someone who wants to sign up, wants to be part of this study. What does that entail?
Good question. So, what happens is we have a pre screening process. And so, usually, we get pre screeners from events that we're doing, whether it's community events, whether we're at churches, whether we're at just a variety of places talking about brain health and equity. And you have to be at least 60 years old. You have to be an African American woman, biologically born at birth, and that we can go into more details about why that is the case. And then you also have to not have any diagnosis or known diagnosis of dementia. So if you meet that criteria, then you would go to the screening process where we look a little bit more in depth to your medical background. We do have some exclusion criteria. Our inclusion criteria is pretty broad, but there are certain things. For example, if someone has end stage renal disease or end stage heart failure, there are certain conditions that would dismiss one from being from the study. Also, things like a history of cancer, receiving chemotherapy, because we do know that with chemotherapy, there are a lot of things that it does to our body and our brain. And so, anyone that is entering our study, we don't want that to affect some of the outcomes. So, let's say that you get past the screening criteria, then you would come in for a baseline visit. And at that baseline visit, we would do a battery of thinking tests, what we call neurocognitive testing, but AKA thinking tests. And that takes about an hour. And then we would also do a blood draw at that visit. And that blood draw, there it goes to two places. So one lab, it goes to look at markers like cholesterol, hemoglobin A1C, which, as many know, is indication of diabetes or prediabetes. We're looking at inflammation, which we know has a unique component to dementia and Alzheimer's. And so after that baseline visit, before I forget, we also look at activity level. Because we do know how important activity level is, not just for our bodies, but our minds. So we're looking at activity level and sleep, because there is a connection between sleep apnea and increased risk of dementia. And many people have sleep apnea and they don't know that they have sleep apnea. So we look at that as well. And then that's our baseline visit. And then a year later, we have a midpoint visit or our 12-month visit. There is no cognitive or neuro thinking tests involved in that. It's primarily just questionnaires that we ask. And then the second and the final, excuse me, not the second, but the third and final piece of the study is at the 2-year mark. And it's essentially a repeat of the first visit, which is the baseline visit.
So if obviously there is a lot that you are collecting in terms of data and understanding and interpreting these outcomes, you're focusing on the inflammation part and you're focusing on the accumulation of the tau protein in the brain. Is there like a correlating other comorbid diseases that make this a more of a focus for you? I know, for example, you mentioned diabetes. Is that why this is such a crucial focus with this particular group?
Really good observation. And I would say, in short, yes, we do know that African Americans and African American women in particular are at disproportionate numbers when it comes to diabetes, have disproportionate numbers of hypertension and heart disease. And so we do know that these types of chronic comorbid conditions, they don't do anything to help prevent dementia
Hmm.
and Alzheimer's. I'll say that. And if anything, there is what we are appreciating more of a association between some of these long-term conditions. And then we also see that stress, and we don't talk about it, but that's another thing that we're looking at
Hmm.
with some of our questionnaires, just stress and the environment in which people have grown up and what type of environment that they're currently living in. We know that as minorities in the US and specifically in San Diego, our experience is different than other majority or predominantly white our counterparts. And so the
Hmm.
way we just experience life and the things that we go through are very they can be very hard on us, whether it's discrimination or whatever that we're going
Hmm.
through.
Yes, and I completely agree with you, Dr. Jackson. And one of the things that I think is really important for families to know is that, and many of them feel this way, is that they're alone. That they have the individual that they're providing care for or support for. Maybe they don't self-identify as caregivers, but they are caregivers. Maybe there's just I'm just daughter taking care of mom. Or and I say daughter because usually it's the woman who's the family caregiver, right? And but there are resources like through Southern Caregiver Resource Center where we provide this comprehensive caregiver assessment, focusing now on the caregiver, helping them develop care plans, helping measure levels of stress, of burden, even depression, so that we can connect them to some of our services that can help with these types of situations, or connect them with other resources out in the community that might be more suitable. Maybe they are stressed because they have meals, they don't have they have food insecurities. We can connect them to different services. Maybe they have legal issues like they need powers of attorneys. We can connect them with some of our partners who do powers of attorney and legal services and so forth. But we also provide counseling, we provide support groups. Martha has these wonderful educational programs that really teach people how to be better caregivers, but also how to care for themselves, which I think is incredibly important from the standpoint of caregiving. You are able to care for yourself and the individual for much more longer than without any help.
I am so glad that you're really focusing on finding more, and therefore, I'm assuming the outcomes that you get is might inform ways to address these situations. So, I guess my question is, what is the plan after you collect the data? How long is the study for?
So the study is funded for 5 years, and the participant involvement is 2 years. And we have a sample of 100 participants that we're
Mm.
looking at. So 50 from the Los Angeles area and 50 from the San Diego area, and we're still actively recruiting. So.
That's good. That's good. I am really glad that that we're here talking about this, and I hope that people do feel compelled to participate and to learn more because, I know you're selectively working on this group, but it definitely can apply to so many other groups. And even, I was talking when you were talking about stress. we could all benefit from some stress relief, right? Or some stress management methods, and in how to reduce the negative impacts that stress has on all of us. And I think it is about focusing on the overall well-being of ourselves, not just as individuals of a certain group, but obviously as caregivers or just as people in general. So I'm very glad that you are doing this study, and hopefully more people can connect. Did you want to mention your contact info so that if people are interested, they can sign up?
Absolutely. And I appreciate the opportunity to share with the community, the listening community here. The main point is getting the education out there. So beyond the study is important, but just getting the education on the importance of brain health for
Hmm.
our community. But for those who are interested in learning more about the study, we do have a website that can be visited that has all of our contact information, and that is www.b-wits.org. And so that is a place that has all of our contact information and numbers, emails, and just all types of information that is going on, even studies that are coming out, just to give a place for people to see what we're doing.
That's wonderful. Thank you for sharing that.
I am so happy you're here, Dr. Jackson, and I also want to commend you and your work with Point Loma Nazarene University and UCSD, and how your studies are really ingrained in cultural adaptation of programs as well as research, to making sure that they're very accessible to families that we're really trying to go out and improve access to these types of programs, because they're so important. And like you said, um, some populations are less studied than others, and it's really important to get that kind of data, that kind of information, that experience from different populations, because as we know, uh, Alzheimer's disease, how it develops, um, it differs from population to
Mhm.
population, and how we cope and adapt as well to it. And one of the very important things, and we know this at Southern Caregiver Resource Center, we practice um, cultural adaptations. We don't just say, here's a program, take it off the shelf, and then just translate it. We actually work with researchers and do some cultural adaptations. And we test it and we focus group it before we even put it out into the community, because we want it to be not only a good program, but impactful in
Mhm.
changing behaviors or lives, and that makes it worthwhile. So I appreciate the work that you're doing at the university.
And I'm happy to know that we're all fellow San Diegans and are from here, from the community. So we definitely understand it and know firsthand how to address some of these systematic issues that have been here for a while. So again, thank you so much for sharing about the study. It's really a pleasure to have you here today.
Thank you for having me.
Well, that's all the time we have left for this edition of Let's Talk Caregiving. To hear more of our podcasts, follow us on your favorite podcasting platforms or visit our website at scrc.care. I want to thank Martha for co-hosting another important discussion, and Dr. Michelle Jackson for joining us today, and our audience for tuning in. If you're providing support to a loved one, you don't have to do this alone. Asking for help is not a sign of weakness, it's a sign of strength. To connect to our programs and services, visit our website at scrc.care or call us at 1-800-827-1008. If you live outside of San Diego and Imperial counties, visit caregivercalifornia.org to connect to the nearest Caregiver Resource Center near you. To support our efforts and make a tax-deductible donation, please go to scrc.care and click on the Donate tab. And remember, SCRC is here for you,
Caring for those who care for others.